It is my great honor at this time to introduce my colleague, Deb Lancaster. She is the moderator of the first conversation, Women's Power and Resilience, Organizing for Care from the Local to the National. Deb Lancaster is the Executive Director of the Center for Women in Work, committed to advancing research, education, and programming that promotes economic and social equity and justice for women, their families, and communities. Recently, the center partnered with New Jersey affiliates of the National Domestic Workers Alliance, documenting the working conditions of domestic workers. CWW is also conducting research exploring the lived experiences and effects of unpredictable scheduling on women workers and their families, and assessing New Jersey's paid family leave policy. Prior to joining Rutgers, Deb served for over 10 years on the leadership team of the New Jersey Department of Children and Families, leading transformation and systems change in the human service arena. Debra began her career as a union organizer with visions of organizing childcare workers. She has a master's degree in labor and employment relations from Rutgers University. Welcome, Deb.
Thank you so much for Rebecca, and to the IWL team for bringing us all here together today. I also want to thank the team at the Center for Women in Work, and just say that the support and understanding and perseverance of my Rutgers colleagues over the past year has certainly contributed to my own stores of resilience and has kept them accessible. And for that, I'm so grateful. For 26 years, the Center for Women in Work has been working on efforts to understand and advance how paid and unpaid care work fits into our economic, political, and social landscape. And here's what we know. Care work is essential work. It was so before the pandemic and will continue to be long after. Care work is intimate and messy. It's physically demanding and emotionally draining. It can be meaningful and rewarding, lonely and traumatizing. Care work is skilled work. It helps raise our future, comforts our sick, and helps us take care of some of our most basic needs when we're not able to. It helps us live, it helps us die, and care labor is the hidden backbone of our economy and our society. Paid care workers, including home health aides, nursing assistants, child care workers, and direct service workers, are some of the lowest paid workers in our economy. For example, here in New Jersey, a wealthy state, home health aides' annual salaries range from about $23,000 to $25,000 annually. Like many undervalued jobs, this one is done disproportionately by women and people of color. 95% of home health aides in New Jersey are women, more than half immigrants, and almost 70% are Black or Latina. We also know that as a nation, we lag behind in the ability for workers to access paid leave to care for themselves or a loved one in their time of need, whether that be a birth of a child or an illness of a loved one or a disruption caused by a global pandemic. And even in states that have passed legislation, like New Jersey, access and the ability to take leave remains unequal and uneven, especially among workers with the least status and power. Today, I'm super excited to hear from each of our panelists about their reflections on the intersection of care work, the current moment, and their own work, which includes developing women's leadership and social movements, raising standards in the care work industry, and working with marginalized communities on the ground to achieve community health and well-being. We have a scholar, an attorney, and a healthcare leader with us today, each also an organizer, an advocate, and an activist. Dr. Sheri Davis Faulkner, a native Atlantan and interdisciplinary scholar activist, is the Associate Director of the Center for Innovation and Worker Organization and an Assistant Professor of Professional Practice with the Labor Studies Employment Relations Department here at Rutgers University in the School of Management and Labor Relations, and also my colleague. She co-directs the National Will and Power, which is Women Innovating Labor Leadership Program, a bold, ambitious initiative to identify, nurture, train, and convene a new generation of women labor leaders. She has been a member of the Crunk Feminist Collective since 2009 and currently serves on the board of the National Black Workers Center and is a steering committee member of the Advancing Black Strategists Initiative. Dr. Davis completed her doctorate in American Studies at Emory University and holds degrees from Ohio State University and Spelman College as well. Rocío Alejandra Ávila is the National Domestic Worker Alliance's Senior Employment Law Counsel and State Policy Director. She is the daughter of Mexican immigrants and a community activist from San Francisco, California. She has over 14 years of experience as a workers' rights attorney representing low-wage immigrant workers, including domestic workers, day laborers, restaurant workers, and janitors. Prior to NDWA, she was a senior fellow at the Women's Employment Rights Clinic of the Golden Gate School of Law and co-director of La Raza Centro Legal's Workers' Rights Program in San Francisco. She is a graduate of Golden Gate University School of Law and the University of California, Santa Cruz. And finally, Miriam Mersad has been the director of the Robert Wood Johnson Barnabas Health System, University Hospital Community Health Promotion Program for the past 29 years. I find that nearly impossible, Miriam. In this role, she is responsible for the coordination of accessible, quality preventative healthcare services and educational programs for communities in Middlesex County, New Jersey. I am a proud Middlesex County resident, right next door to New Brunswick. She partners with houses of worship, health institutions, and community-based organizations in the design and implementation of culturally appropriate community-wide health promotion initiatives. She's received numerous awards for her contributions toward improving the quality of lives of our residents, and holds degrees from the University of Puerto Rico and Rutgers University. Thank you all for being here. We are going to open the discussion with a question for each of you so that you can introduce your work and how it intersects with care work and how the pandemic has impacted what you were focused on prior to the pandemic. And Miriam, we were going to start with you. Let's see, where did she go?
Right here. Hi all. Thank you for the invitation. And yes, it's been going to be actually 30 years this year. But there's no dull moment here when you do work in the community. Every day is a new challenge and it's a new way of doing life, right? So this has been my journey here. And I'm very excited for this opportunity as I reflected on this question. You know, I am a result of care work in this city, right? I came from Puerto Rico. I went to school here at Rutgers for the graduate program in labor studies. And I remember I had to get a job right away, and I ended up being a security guard in one of the senior buildings here. And it was a network of seniors, of Latino seniors in that building that recommended me for my first job in this city. And that's the beauty of care work. You know, these ladies were taking care of me and their families. So I wanted to highlight that that's the way I started this work in this community, and those connections and that network has been essential in the work that I do. So I'm director for community health. My role is to improve access to preventive primary care, information, and education for the vulnerable communities that we serve, especially here in the city of New Brunswick. We do this through aggressive community outreach and the formation of community partnerships. We have a model of using community health workers, or promotoras, how we call them here, to engage residents in identifying needs and putting programs together to address these health needs. And as we define community health promoters, those are your care workers here in the community, right? They are from this community. They go through the same issues that many of our community residents go through, but they have found a way to give back, to have a meaningful experience here, not just being immigrants and trying to do better for, you know, themselves and the families that they left behind. This work also has given, like you were mentioning, casework, you know, a care work can also be meaningful for many people. How we you know, it was because of them that we survived this issue of COVID in our office, right? It was because of their contacts. It was because of their resiliency that we were able to continue to provide services in the community. They had the connections at the right time. They had the trust of the people at the right time. And so through the pandemic, they were able to organize the food drive. They were able to organize the cleaning supplies, that people identifying who didn't have medication and who we needed to serve during critical times, how people could quarantine, which was a big issue in this community, and also raising their voice so the hospital knew what were the specific issues in this community, how we needed to raise funds to make sure that we have places for people to quarantine, because it was very difficult when I translated those first discharge instructions that said, you know, go home and quarantine. I knew right away that we were going to be into a lot of trouble, right? Because our people didn't have a thermometers they didn't have cleaning supplies because everybody else went and bought everything and they didn't have that kind of money. So the promotoras, those care workers here, were essential in making sure that we were getting to the most needy families in the city. And they were able to volunteer at the testing sites and also push for the testing sites to be here where people could walk to, because the initial testing sites were not in a place that there was even public transportation. So they were able to push for those things to be here in the city that they could volunteer at and translate and make people comfortable about giving their information when they went in. Also being the same people that, you know, were able to give them their results and trace them, and now working in the vaccine clinics. So you see that continuity of that care work. I don't want to take more time. I know that other people want to say other things, but you know, that is the intersection between the work that I do and care work in this city.
Oh, thank you for getting us started, Miriam, and that work is really important. Yeah, those early days, and I say this just because I live right next to New Brunswick. You know, the supplies were low, and you know, folks, you know, the shelves were empty, and there was no place to quarantine for many people. Rocío, would you like to go next?
Sure. Yeah, I was, you know, listening to your story, Miriam, and it's very inspiring. So I come to this work care from a personal standpoint. My mom was an immigrant, and her first job was as a house cleaner, eventually became a janitor, and was able to become a union member in San Francisco at Local 87. And through my experience, I've been able to see the difference in what it had an impact in her life, being able to eventually have some benefits as a union member, and what her experience was as a house cleaner in her early years as an American woman. And that experience really kind of shaped my trajectory. And I chose the field of employment law, mostly due to my own immigrant experience as a child of a house cleaner. Now at the Alliance, most of my work, and in the last year and a half, really has been to focus on addressing those gaps, right? And these are gaps, as you pointed out, Debra, that were there pre-pandemic, but that we've seen exasperate in the community. In the early days when the shutdowns happened, we were getting calls constantly. We weren't able to have enough membership meetings, which were typically once a week. For those of you who not know about the Alliance has over 60 affiliates across the country. We were founded in 2007, and since then, in my role has been to raise standards for domestic workers in state and local policy. And this past year, those considerations were fully put up in bare display about the gaps, and predominantly in the area of loss of wages. Our members are predominantly workers who are working informally, who are not eligible for unemployment insurance, who, even if they are in states like New Jersey that has paid sick time, unfortunately aren't able to reach the eligibility hours due to the nature of the work, which is mostly that means that they have multiple employers and aren't able to meet the criteria that is necessary. The membership has also been very clear about issues regarding health and safety. Homes are workplaces, and the narrative about what was a workplace, an essential workplace, was really the hospital or the supermarket or other places that we all as a community need and rely. And most people didn't think of the home as a place where care was already happening, right? Whether it was a person that needed home care and they were seeking a home care worker coming into their home, or they needed obviously childcare and other maintenance in their home, including running errands. While most of that in the first couple of months did pause to some extent in the house cleaning industry, the home care and nanny work did not. And so what I saw from a legal standpoint and policy is that while essential workers were defined in a certain way, for domestic workers, even if we were referred to as essential workers, the law didn't necessarily protect and extend the same protections that the same workers and employers that they were supporting at home had coverage and protection. So this past year really has been for us to really pivot on what it means to have health and safety in the private household, reinforcing the need to expand that the definition, but also to make employers and the community at large understand that if there weren't specific PPE safeguards for workers that included domestic workers, the pandemic was not going to be addressed comprehensively, because workers were coming in and out, and in some cases were asked to stay and become live-in workers so that they could avoid having to take the subway or avoid getting in Uber, Lyft, so that the risk factor in bringing the virus into their homes was minimized. However, workers were not compensated more for that. They were not given the money to take the Lyft and Uber or to buy their own PPE. And so I have been focused in understanding how to change that. And most recently, we have focused on what is the distribution of the vaccine, right? What does equity mean for women of color, for low-wage workers, for immigrant women, in places where they have a very hard time figuring out how to get the vaccine, mostly because of the way that people are being asked to register and access it, which relies on technology, on certain level of literacy and ability to know how to ask for help. And so our New York chapter, our Philadelphia chapter, our DC chapter, and in California have really pivoted to be able to get people on board and assist them in understanding how to be vaccinated and figuring out a way to make sure that everybody has access to it. In most cases, many employers have required that domestic workers, before continuing to work for them, that they prove that they've been vaccinated, which that's a separate issue about whether or not that's even legal. But most domestic workers want to be vaccinated. They want to be, they want to protect themselves, they want to protect their family, and they want to protect the people that are hiring them. The problem is whether they have access to it and whether or not the requirement of vaccination can be used as a pretext for retaliation for other reasons. Thank you.
Thank you so much. Dr. Davis.
Call me Sheri. Hi, everyone. I'm really happy to be here, and I really appreciate you creating a space for this, Debra, and also being able to be here with you, Rocío and Miriam. In many ways, because I work at a national level, I often feel like one step removed from what's happening. I am the Associate Director at the Center for Innovation and Worker Organization, and I want to explain that the center, our mission is to promote strong worker and community organizations to shift the balance of power towards greater equity in our economy and our society. So I want to put that out there. I specifically co-direct a program called Will Empower, which is Women Innovating Labor Leadership. I've been doing this for the past almost 4 years. And one of the things that happened when the pandemic hit is that we were rounding out our cohort of women labor leaders from across the country, our executive leadership cohort. And one of the things that I learned very quickly is that it is important to have a network, because in the moment where we were gearing up for our last retreat and everything started to shut down, we had a labor leader in Pacific Northwest who was able to say, here's what's happening in Washington. This is what we're seeing on the ground. These are the types of things that have happened just in a week. And having her get on the phone with all of the folks in the cohort and give a kind of a rundown of what was happening created the opportunity for these women leaders to be able to give suggestions or start thinking consciously, if this thing happens in this state, what's going to happen? If this thing happens in my city, what's going to happen? And so the ability to move information quickly so that it could actually allow for scenario planning and really put people into action to take seriously what was going on mattered. This is a cohort of predominantly women of color. This is a cohort that includes not only labor leaders, union leaders, but also worker center leaders and community-based organization leaders. We identify labor expansively. And so that means that the way that we started to respond, in some ways, one of the value of having a labor union is that they can often activate very quickly and move resources to be able to support their members. The challenge is when folks are not organized, are not within an organization, they either don't get information and they don't have the opportunity to benefit from those kinds of resources. And this is where worker centers and community-based organizations come into play. And so what we saw was development of mutual aid funds, funders reaching out to us saying, we're trying to get money to the field. How do we do this? Who's set up? Who's ready to go? We had an organization and networks that were preparing, okay, we see that the stimulus is going to do the thing that it often does and leave our folks out, and predominantly women and people of color were the ones who were being left out. And so they started pooling funds to be able to provide resources to people who are identified as essential, but don't fall underneath the categories. And quite frankly, I want to remind us that last year we were under a very different administration that was not supportive. And so there were very many people who were left out intentionally as a way of weaponizing what it means to have a security net. And so to be able to move information quickly, to be able to share strategies, to strategize together, and to recognize that they didn't all have to have the answers. So for me, I'm already thinking that when we talk about care infrastructure and putting in place the ability for these types of things to happen broadly, that what I got to see was what happens when you already have an infrastructure that has a care ethic. That means that people are working with each other and for each other across organization, across the country, with the understanding that we have to take care of our people, right? We have to take care of our people with the resources and tools that we have. And when we know that we're about to be left out, we have to pipe up and say, hey, you're going to have to do something different. This is what equity would look like. And so we had scenarios where people were new to leadership, where they had to push outside, and punch above their weight and basically be experimental, take risks, and say the things that they might not have said had this not been the situation, where they had to, they required their health department to actually look with an intersectional lens. So it's not enough to think about what was happening by race or what was happening by gender, but that there was a need to understand what was happening to women of color, right? And and that's not only in terms of how the pandemic was impacting them and people, whether they got COVID, were dying of COVID, you name it. Keeping data around that and sharing that data mattered, but then also being able to bring in resources to be able to meet the need. So that meant testing, because as we remember, testing at the beginning was very challenging to get, yet we were being told, hey, get back to work, or our care workers were being told, get back to work. And so these are the things that I think happen behind the scenes that no one would see. But I also want to make the very important point that we are not having this conversation in the way that we're having it had we not had these people behind the scenes shifting the narrative, right? So in the moment where people were saying, we're clapping our hands for essential workers, right? The video that was actually put out by the Ford Foundation, where they said, well, let's clap back, right, against worker inequalities, against worker inequities. And that clapback said, hey, before this pandemic, we weren't taking care of these needs, right? Currently, we're not taking care of these needs. And so whatever we build right now, we need to be building it to make sure that we're remedying the past and we're addressing what needs to be happening in the future. And so these, for me, this is the way that I get to have a touch for the things that are happening on the ground. But I do want to lift up why it's so incredibly important that we have women in leadership positions, that they are able to bring their full selves, their authentic selves to these spaces and to these roles, because we start to see a very different kind of conversation and a very different kind of way of taking care of those who are most impacted and least protected. Thank you.
Thank you. I mean, that's I have a few questions I wanted to follow up with you all on. And, one of the things, and I don't know if, I think some of you had the chance to listen to the Angelides lecture with Naomi Klein, and it included remarks from Representative Jayapal talking about the National Domestic Worker Bill of Rights. And Rocío, I'm thinking of you in particular. We know there are other policies that advocates have been fighting for that promise to raise labor standards and lift families out of poverty. And I'm also kind of connecting to, some of what Sheri was just talking about. Well, actually, I think everyone touched on it, and that's, people are left behind. And even when we have a standard or we have a policy, not everyone gets access to it. And so I was hoping, or can access it to it. I know what it was, Sheri, when you were saying, if you're a member of a union, it's that we're actually interviewing some workers right now about the implementation of New Jersey's paid family leave. And what we've heard, where do workers get their information? So if they happen to be in a union, it's only the union. It's not HR, right? It's not HR. And even in other places, it's typically word of mouth. Unfortunately, it's not HR. Sometimes it's HR. They have an important role also. So I wanted to kind of get at, understanding, especially since each of you do work that the type of work you do. So we have a National Domestic Worker Bill of Rights. What is it? But what I've read about it, Rocío, is a little bit different than some of the other bills that might have passed or some kind of other labor legislation. And I wanted you to talk about like what needs to go into that, both in the policy and on the ground, to be inclusive of workers. Like, because I know it's not just about, I know when I was a union organizer, somewhere along the line, I learned that collective bargaining agreements are worth the paper they're printed on, right? Like maybe they're worth that you need all this organizing behind that. The members need to be engaged in the union or else it is just a piece of paper. So I'm going to stop talking, but I'd love to hear more about, what's the thinking, what's the kind of the energy under that. What are you looking to do with the national, with the Domestic Worker Bill of Rights?
Sure. As background, the Bill of Rights was actually this is the second introduction. The original bill was co-sponsored by now our Vice President, Kamala Harris, and Representative Jayapal. So this is the second round, and obviously for obvious reasons, it didn't move in the first session. And the bill has some changes, but very minor. In essence, the bill continues to have a skeleton of basic protections, but also mechanisms for enforcement. And I'll go into it in a minute. But the bill is a reflection of over 20 years of advocacy. And it really is anchored in the gains that we've won at the state and local level. At this point, the Alliance has supported the advancement of 10 state bills of rights. I'm about to introduce a New Jersey bill. Thank you so much for your support in the research phase that is really anchoring and addressing the comprehensive needs of domestic workers, in particular wage theft, and how when we talk about the care industry, we need to understand the intersectionality of the various constraints that affect especially women of color, that they may be asking for PPE, but they are at the same time probably not getting paid everything that they should be paid. And they are also probably not getting access to paid sick time or unemployment insurance. So the federal bill is taking the most key and pressing issues that our membership, we have worker councils that have been established for the past 5 years. And they are set up by worker category or industry, home care, nanny / childcare, and house cleaning. And they basically voiced in many different ways what their priorities were. And so the National Bill of Rights is still striking exclusions. Unfortunately, while there are basic protections already at the federal level related to minimum wage and overtime, the Obama administration with the organizing and advocacy in the ground of many organizations was able to change and create a new home care rule that lifted millions of home care workers out of poverty by extending minimum wage and overtime. This just happened less than 10 years ago. So when we talk about equity, we need to really anchor it in the reality that some people just got the right to minimum wage and overtime at the federal level. So the National Bill of Rights is going to strike the some of the existing wage and hour exclusions that impact mostly live-in workers. For those of you who may not be familiar, there is a growing demand of live-in workers as many more people are staying in their homes, in particular receiving long-term care, and live-in workers, not just housekeepers for people who are wealthy, but we're talking about live-in workers who are going to provide 24-hour care for seniors or people with disabilities. So that's one aspect. The other big aspect is industry standards, things like meal and rest breaks, written agreements. Let's see, I'm part of the team that drafted. Most of it is industry standards, but we also have included enforcement. And so this question of the distinction between what are some of the rights and kinds of resources that union members get versus those who aren't able to get a union collective bargaining are things like a worker standards board. So our bill addresses the need to have basic labor standards with a mechanism to create that ability to sit with employers, and in this case, the Department of Labor, who we would be able to really pave the way and create basic standards that go beyond what the federal law at the moment is, and at the same time would allow us to develop the leadership development of our members in this more comprehensive way. And some of these strategies are currently being tested in other jurisdictions. So Seattle's Bill of Rights has a standards board that we passed over 2 years ago. Philadelphia's Bill of Rights has portable benefits for paid sick time law. And all of these components will be addressed and discussed, hopefully in this worker standards board. We're very hopeful and optimistic with the new administration, the leadership of the Department of Labor, especially with Julie Su, recently confirmed, who is coming from my home state of California and who understands how to basically address enforcement on a comprehensive, and the role of government, right? And the role of having a partnership with community organizations that are in the ground directly addressing the specific needs of workers.
Thank you. That it feels encouraging, but I know it's a lot of work. And thank you for giving us the context about how many decades this has been going on. And of course, domestic workers and farm workers were intentionally left behind, right, from labor standards for a long time. Miriam, I was wondering, so in your community, our community, how has the legacy of undervaluing care work impacted the community that you work with? And, I was wondering, and I'm also thinking, and feel free to chime in on the, this phenomena of wage theft, which, in the groups of workers that the center has worked with, both, my time at the Center for Women in Work and in other hats that I've worn, wage theft is unfortunately all too common. And we know it has an impact on family well-being. I don't have data, but I'm sure it has an impact on family well-being and kind of meeting basic needs. But I was wondering, if you could talk a little bit about the legacy of undervaluing care work, how you think that's impacted communities you work with. And then how do communities care for each other when policies and politicians or government falls short? I know that was a few different questions. You can respond to it however you'd like.
I think that, in the community that I work, mostly of immigrant community, of course, we see a lot of the times that women that spend their life taking care of their children, of their parents, of their relatives, are not sure who's going to take care, who's going to have the resources in their own families so they can take care of them. I think I see that creates a lot of stress in a lot of the families. And because there will be no access to SSI or to stimulus checks and none of that stuff, right, for many of them. And that creates a lot of stress in the long run for families, even families that do a little bit better. I have my 87-year-old dad that I brought with me from Puerto Rico after Hurricane Maria. And it's a labor of love to have somebody at home. And, there's the trail of people day in, day out, taking care of him. And that's when you really see the need of our people, right? Especially single women, and the pandemic compounded many of the issues. I remember that one day me leaving for work and left the house, and the last thing I checked was there was a 5-year-old in my kitchen table, going to school, that she, the mom is you know, taking him from one house to the other, and we had to have a conversation. I said, well, let me call the school, see what's in place. There was nothing in place in the school for these women. It was me raising the boys, and many of the women raising the boys, that the school then needed to make a list of places that they could have for, you know, single moms that had kids and had to work because they didn't have any other choice to pay rent, to pay for food, that we could do that. So we see firsthand that impact, but we also see firsthand how can communities get organized to, you know, New Brunswick has been an example of wage thefts and, you know, picketing in front of, you know, restaurants that they don't want to pay, or contractors that don't want to pay the workers, and, you know, they use social media and they use picketing outside and there's a number of, you know, immigrant organizations in town that have done a lot of that, you know, legwork to make sure that the workers are protected, that workers know their rights. And Rutgers, you know, has been supportive, but that's not in every community, right? We need to expand that kind of work. Communities are resilient, immigrant communities are resilient. They, you know, I during the pandemic, we saw, you know, really thinking outside of the box. We have the one lady that, you know, she saw that a lot of the kids were going out with no birthdays, you know, and going out with women going out with no baby showers. So she had this idea of doing baby showers on a box, you know, birthdays on a box, and she will collect donations and go and help that family. And like that, there's many examples of ways that women will organize in this community, creating these huge safety nets among themselves, which is critical for many of them, that they can call each other, that they know each other, and they support each other when one is sick, when one needs food, when one needs to be convinced to go to the hospital or call the police, right? Which is so important that they have that peer-to-peer communication. They create their own organizations through church, you know, they reach out to community-based organizations to identify resources that they need, and they support each other in times of need, like I said. So I think that at the community level, people have learned how to survive, you know?
Yeah.
And we need to support that kind of initiative. We need to continue to engage that and be that support, finding resources for them, because sometimes with immigrant communities, they're not going to be eligible for any of the governmental assistance. So then we need to think outside of the box to provide for those needs.
Thank you. I was just connecting some dots. I don't know if you all have. So Miriam, so New Labor, which is one of the organizations in New Brunswick that has been successful in pushing for wage and getting wage theft cases successfully passed, or whatever the right word is. But you know,
they had sick leave here before the state had sick leave.
That's right. And I wanted to just also highlight that they're actually an affiliate of the National Domestic Workers Alliance, and we're one of our key partners in gathering data to inform the New Jersey. So I don't know if Rocío and Mariam, if you'd realize that, but I just wanted to connect some dots there, because I thought that was kind of fun. Yeah. Like, it's a small world. Yeah. So, and Sheri, this raises a question I have for you, and you can certainly expand on it, but I think that, what is the role? So we're here, and when we're thinking about the local, and your work's national and global, which I forgot to mention in your bio, you're also working with global leaders, not just labor leaders, but other leaders of, I guess, I don't want to say non-traditional, but labor, broadly speaking, right? But what is the role? But we're in sitting here thinking we're here at this university, and it's right next to, and it's, I remember, when testing was scarce, but getting a little bit better. I know there was no testing, and that had to be a fight, which really is quite unfortunate that had to be a fight, because, you think, oh, we're here, we're at the university, we want to be supporting our community. And that, of course, had to be a fight rather than just a given. I wanted to get your take on like what the role of scholarship, you know, because I know there's like always this tension, right? We're so fortunate, it's similar in the labor studies program. We have, you know, some scholar activists and you're among them. And so I wanted you to talk a little bit about what you think the role is, what it isn't. And I'll stop talking.
Yeah, you know, that's really, I'm glad you said that, because as soon as you started talking about wage theft, there were a couple of different things I was thinking about. One, the working paper that my colleague Janice Fine worked on and has worked on in community with a number of different organizations, but specifically saying, hey, we've kind of been here before. What happened during the last crisis? You know, and going back and saying, oh, the violations spiked. Okay, so we can probably assume that something similar is going to happen, and I kicked into gear doing research around that. And so, you know, there's a working paper called Wage Theft in a Recession that came out February 18, 2021. But I also want to offer that, you know, being able to pivot is an extremely important piece. I mean, we had to mourn the shift, but the recognition that doing and being online opened up opportunities to be able to do things that we normally would not be able to do. One of the things that I did was to reach out to my alma mater, Spelman College, and say, hey, we need a labor course, right? Like we need to put together a labor course. And I worked with my colleague, Danielle T. Phillips Cunningham, Dr. Danielle T. Phillips Cunningham out of Texas Women's University. And we put together a course called COVID-19 and Black Workers. And to our knowledge, it might be the only course at an HBCU that is focused, that centers Black women in a labor studies course, right? And, you know, some of the things that we've been able to do were one is to speak to this piece around the narrative. Domestic workers have been shaping labor for more than a century. Like as long as there has been domestic work and there have been policies to try to improve labor, domestic workers have been shaping them, right? And so the problem is that oftentimes we don't know the lineage. We don't know the names of these leaders. We don't necessarily, they don't get celebrated on a holiday. We don't see them, they don't show up in the frame. And so we actually spent time, actually, I'm gonna lift up her book because it's Rutgers University Press. But we spent time really thinking about what does an intersectional racial formation look like? Like what happens when you take the bodies of Black and brown women and center them? What kinds of conversations do we now have around what it means to have protections, what it means to resist, what it means to be able to shift the way that you are conflated, right? Because we do have to understand that when we talk about care work, it's not just that it's conflated with women. It is conflated oftentimes with Black women, with immigrant women, right? It is feminized in the way that makes sure that it's low wage work and that it is required essential work, right? That there's no way around it and that there's no supports. And so, you know, being able to teach this class at Spelman College online, and to also recognize that the reason why Spelman even exists is related to a domestic worker struggle, right? Is related to the washerwomen strike of 1881. And so, you know, having the opportunity to bring forward Jocelyn Fry's work, she put forward this argument again that we need to be looking at having an intersectional lens and talking about how this is impacting women of color, but not in like a big category where everybody's lumped together. But here's how Black women are impacted. Here's how Latinx, Latina women are impacted. This is how Indigenous women are impacted. Here's how Asian American women are impacted. And let's break that down even more, right? Because everybody can't be conflated. These are the types of jobs that they have. This is the type of pay that they have. These are the types of responsibilities that they have in their community. Now let's shape a policy that actually speaks to what their needs are, what their struggles are, what has been a struggle, right? How do we remedy some of that and put policies in place that make sure that as we move forward, that we don't like start to conflate people back into these categories that don't make people make sense. And so I think that the good thing that has come out of this is that those scholar activists who were ready to go, right? Like when I think of Jocelyn Fry, she's like former director of policy and special projects for the First Lady, Michelle Obama, right? And so like to have her on the ready as soon as the opening to being able to talk about these things in the terms that it exists, to start putting this data out and making sure that we're shaping a very different narrative that is, again, not a victim narrative, right? Like people are happy to take the painful stories of care workers and to smash them underneath, like as a bullet point, to tell their own larger story. But to be able to put forward the stories in their totality, to put them in their own context with the interlocking oppressions that they are dealing with, and then to be developing remedies from that place, those who are most impacted, those people in the room, right? That actually is the thing that is going to move us to not only how we think about just shaping particular policy, but how we think about labor writ large. And one of the things that I'm hoping comes out of this is that we stop actually, it's fine to have a conscious approach to the types of things that women are dealing with as it relates to work, as it relates to care, as it relates to their own conditions, right? But there are certain things that get conflated with women that are an everybody issue, right? Childcare is a labor issue, period. Most people cannot go to work. They cannot go to work and do their jobs unless they have the support of somebody who is attending to their children, right? And so when we had the school systems actually say, before the cities were shutting down, oh no, we're shutting down. We have to shut down because we have to take care of these young folks. But here, we need to make sure we can feed them. We need to make sure we get these computers out to them. Like they're putting forth what the demands are and laying it all the way out and thinking about, we need to stop evictions. We need to put a moratorium on all of these different things that we know are going to be problems, and we forecast what's going to happen. And so these are the ways that we actually have to foreground these things as not just women's issues, but they are issues for all of us. And that is actually the framing that we need to be using as we talk about what it means to take care of all of our residents.
Yeah, no, I think that's right. These are really, they're everybody issues. Care is everybody's issue. And, oh, Rocío, did you want to comment on that? Let's see, I had a question for you. So in terms of scholarship, and, I'm just, if you could tell me a little bit about, NDWA's, like the Alliance's relationship with scholarship in universities, and what that experience has been like. And it either barriers or what that's, because we're not always the easiest people to work with, I hear. So I was just wondering if you had, messaging or something you want to share with the university members of this who are attending today.
I welcome the partnerships all the time, as I'm hearing all of you, Sheri and Miriam, everybody, and the role that we basically, when we're thinking about a new proposal, have to think about we're coming into a community that our base is there, but as a lawyer, as an advocate, I am coming from social science as a sociology student. I see everything interlocking. I cannot do my job as an advocate if I can't support it and back it up with data and evidence, right? And so while our base of workers doesn't walk around thinking of these things in that framing and in that way, it is incumbent on myself and our team partnering with the folks who have the training and the tools to be able to help us figure out whether it's the inquiry, the research question that we often know very well because we know it directly from the folks who are experiencing it, but to be able to put it in a way that's actually going to be valid and seen as science that we can actually use it for purposes of our, advocacy. It's absolutely essential. I have a number of projects right now, one with CUNY, one with UCLA Labor and Occupational Center. That's the only way that we as a nonprofit national organization can really be able to embark in some of these legislative and legal advocacy reforms, because we need to be in sync and ensure also that universities are really accountable to the community. And I think the only way to do so is that research is really grounded in the experience of the people who are directly impacted. And so as a lawyer, my job is putting people together, me being able to ensure that I am getting the necessary research questions that are going to help me make my case, right? But that it's really grounded even for myself, from me having contact with the workers, right? And that comes from my own personal advocacy, whether it's in litigation or in negotiations with legislators who are asking very hard questions, right? And so I already know in advance that I am not going to embark in a new legislative fight, like in this example, New Jersey, without knowing that we have, data that really supports and grounds why I'm asking for those fixes. And especially when we talk about fiscal implications, right? And most of the constraints that we have faced in state and local municipal work has been that the cities and governors say, that's fine, we will remedy the situation of domestic workers, but we just don't have money to be able to attach to this bill to be able to really make these rights meaningful in nature. And so the only way to do that is to say, actually, there's an intersectionality. If you care about healthcare and equity, you have to care about ensuring that your Department of Labor actually has the money to be able to address wage theft and discrimination and sexual harassment, because these things don't happen separately. They are interlocking.
Yes. Miriam, what's been your experience with, I know that we shared a workshop together recently on research methods with marginalized communities, or a way to engage marginalized communities, Photoshop, right, that we did. I think that was in the fall, right? It seems like a long time ago. But I'm wondering if you could talk a little bit about how your work intersects with the university or research in the community, or if you're working on any projects that build capacity in the community to gather data. Oh, I think you're on mute, or we have, let's see.
We are working with a number of research people in the community, and this has been a long process to find the ideal people working in communities to gather data. You can imagine we sit in the city we're a huge university that needs to do a lot of research. And we always have said, research needs to have a purpose. People need to get information back that is useful for them to continue to do their life. We cannot use all the money for research. We need to have some money for programming to address the needs that we have identified. So it's always been that struggle, but we have found ways to make research meaningful to many of our community or for many of our issues, right? We are currently working in issues related to senior health and how can we better engage seniors in that kind of work. With the School of Social Work, we worked in evaluating many of our summer programming related to community violence, and this information has been very useful for us to continue to raise funds to get additional programming. But of course, we need to have that perfect relationship relationship between research and community, right? And people that understands the limitations that we have as a community and the need to provide that data back to us that is useful, that we can use. I mean, we love to work with our students, but you know, it's been a difficult year with not having students around because a lot of this work is done in the community with many of our students, and we really miss them. And I think that to train them, to train the students to do that kind of work is very important in communities of color, because many of those students are people of color to begin with that come and they understand the experiences to work in cities like New Brunswick and other communities around here.
Yeah, yeah. You know, I think that when I think about research, and when I was in a PhD program a long time ago and I didn't finish it, I left to go actually work for the state. And it was the best move I ever made in some ways. But I remember at the time I was really focused on trying to understand the quality of care and the quality of kind of working conditions or lack thereof in care work jobs. So looking at the fragmented care, like child care, you know, what it could be family medicine, healthcare. And I had actually at the time, I don't know if that would be the case, kind of a hard time finding someone who like was that interested in it. Even at the university at that time in the program I was in, it wasn't in some ways, I guess, considered sexy enough or valued enough. I think times have changed, I hope, since then. But I know one of the things that we hear a lot in our department, and I think just, maybe before the pandemic more, but this phrase, the future of work. And the future of work often, I think, means for people, I think they think about artificial intelligence. I think they think about whatever Jeff Bezos is doing, robots. And when I think about the future of work, and this is also something before the pandemic, we'd get reporters calling the Center for Women in Work saying, oh my gosh, women's labor force participation's through the roof, historic numbers. And, we're like, yeah, it's great. But if you look under the hood, you see that those job and that job growth is largely in care, which isn't a bad thing, but we don't value it. So the job growth was not like in good jobs, good quality jobs. It's kind of low wage, women's work. That's where the growth was for women. I just, my last question, and we'll see if the audience has questions, is like, if you could dream a little bit here and you had like unlimited resources or $1 million, which probably isn't even a lot these days, what would you do, to create a culture of care? So where would you invest in this issue where we have this undervaluation of care work? Where would you start on building this culture of care where we have, where we might have employers and unions and communities that are all encouraging employees to take time off, paid time off to care for each other, where we value home health aides and don't look to, this is my vision maybe more, but every time someone talks about the low wages of home health aides, they're like, well, we need to retrain them or upskill them. And I'm like, they're already skilled workers, right? We just need to pay them more and not just pay them more, but benefits. There's no benefits. There's no retirement. We're talking to workers, if any low wage workers, if they get paid time off, they're banking that. Yeah. They are not taking it, right? They're taking it. They do not think about vacation the way we take vacation at the university. That's what they're telling me. They get vacation, very little vacation. They get sick. Their employers are sending them to, literally, we just had a phone call with someone the other day. They all got sick during COVID. They said, well, go on unemployment and then come back and reapply for your job. That's how we take care of healthcare workers during a pandemic. But anyway, like where would you start, or what would be your kind of closing thoughts on where we could start to build a culture of care? Again, if resources were not an issue. Sheri,
can
do you want, oh, Rocío?
Yeah, I would
And I know
say,
you have to hop off.
yeah, I would say we have infrastructure, we have social security system, we have an unemployment insurance system, you know, be it flawed. But the point that I want to make is that the fact that there are some institutional universal systems that recognizes that the government has a role in ensuring some safety net for its members is the key here. And I think we haven't even really come to grips and definitively come to really agreeing that that is something that we need to invest in. And I would say I would use my money to universalizing, ensuring whether it's family medical leave that's embedded with paid sick time, just even that concept has to be really fleshed out and expanded so that all workers and the employers who are hiring don't have to worry about where the money is going to come from to be able to have somebody come to their home, or in this case, care for their child or their loved one. And that there's a system that's in place where they may have to make contributions, but the worker is going to be cared for and their loved one will consequently be cared for as well.
Miriam, so in other words, we have some structure already set up and we need to invest in that and make it work for everyone as a start. Yeah.
I have two things, right? I will say that, like Rocío is saying, you know, I will invest in that safety net that is broken. It's broken, it has huge holes. You know, I look at hospitals right now, and the new changing culture is that they're going to screen people for social determinants of health, and that's going to create people going out into the community that need services, right? So we don't have that, you know, rolling door that people are coming in for the same thing because they have no medication, gonna have a place to live, all of that. So we need to look at those systems that we can then now invest in our community-based organizations that they have been underfunded, you know, our health departments underfunded. You know, we really need to look at that safety net so we can make sure that people don't continue to go to these places looking for the same services over and over again. The other thing that I have to say is that we need to push for a comprehensive immigration law, right? That we can't continue to have people in limbo forever. So people can have decent jobs with better pay, with health insurance and benefits, so they can use some of these safety net that we're talking about, Social Security and unemployment and all of that.
I want to pause before, Sheri, I have to jump off, but I really have learned a lot and I appreciate this symposium. And yes, thank you very much for this opportunity.
Thank you. It was nice to see you again.
Thank you.
So I actually want to complicate this a little bit, because rather than having just a conversation around investing, I actually want to have a conversation about where we need to disinvest. I'm right now thinking about Ma'Khia Bryant and trying to figure out if she had another number to call, if she had another phone number versus the police, would she still be here? And so when I think about the fact that Los Angeles, California has a $5,304,000,000 budget, and that $2,778,000,000 of it is going towards the police budget, then as far as I'm concerned, there is a way that we need to be disinvesting from particular ideologies of what it means to take care of our people and protect our people, and redistribute that fund towards our hospitals, towards our schools, towards our social safety nets, so that people are making the phone call to the people who are actually going to provide them with care. And so I agree with what Rocío just said about we have infrastructure. You know, I think about caring across generations who said, why are we being pitted against each other? My parents need care. we care about our caregiver, right? Like, how do we get these financial industries out of the care business? And we actually make it so we have the kind of system where those who need it can get it, right? Like in so many ways, care is interrupted by our financial product and the financialization of our systems. And so if we disinvest in these things that are not actually providing us the supports we need, and we reinvest our funds, right, our tax dollars, our money into the places that are actually going to provide that support, then I think we're having a different conversation. And I want to be really clear, like the system isn't broken, it's working exactly the way it was designed. It was designed to exclude, right? And if we don't talk about the fact that it was designed to exclude, then we have conversations about reform versus having a conversation about what does it mean to have a fully inclusive system that is about taking care of people, taking care of people.
Oh, thank you. Thank you. Those are great points. And we have a few questions that have come in from the audience. So I might just, I'll read those because I think that's the way we need to do this on the Zoom webinar format. One of them is, and I'm sorry, I can't see who they're from. How can the media be mobilized more effectively to educate and connect communities about the realities of care workers and the ways they are leading change? It's a great question. Terrible one for me, I think, because I am like the worst at social media and any kind of media.
I think personally, social media, WhatsApp, Facebook is what has moved our communities throughout this pandemic. If you see behind me, we created a first Spanish-speaking Facebook page for this hospital that has 12 hospitals, and it was a struggle, but we said this is the only way. Facebook Live has become the way of communicating with communities around here in their language. So I think social media is so important. WhatsApp, all that stuff that people are using to communicate among themselves and also with their families in other countries are key.
Mm-hmm. Mm-hmm.
Yeah, I actually want to offer that folks got really creative with media. If in fact there wasn't a way through Twitter, through Instagram, through a number of apps that I can't speak to, and I don't know, again, that we're having the conversation that we're having. When we started seeing nurses and healthcare workers taking pictures of themselves in trash bags and crying outside of hospitals, that changed the conversation, right? Right. And so I feel like there's that piece, but then there's the other piece around, yesterday I wanted to know how come I don't have a news source that's national that looks like me to process yesterday and the day before, right? And so there are questions about, like, when we think about media, representation matters and has always mattered. And there's a question around why you don't necessarily have more outlets that allow you to be able to see and hear from people who know you, who understand where you're coming from, and don't other you in the process of trying to deliver news. And so I think that there's a much more robust conversation that needs to be had around like the kind of media that we really need to have and see. And shout out to Democracy Now!, but it's different, but still. And again, I also wanted to speak to the fact that people use social media in very, like this know your rights piece, this, how do you get access to support? People were very creative in using these types of vehicles for spreading information, collecting information, redistributing, that sort of thing. And so there's something really wonderful about this. And I think we need to have a better sense of how do we utilize this so that we can put things in language that people need and be culturally, have it be culturally representative of the types of things that people need to hear as well.
I think that Rocío's gone, but I know that one of the, it's an app called Aaliyah, I think, Sheri, you might know more about it than I do, but Aaliyah is an app that, they're using in Philadelphia. I hope I have this right, but this is, you can find this, you can Google it. But it's the app that employers can contribute to, so that if you have a cleaning person, a worker in your home, a nanny, that you can then add contributions to sick time, to vacation time. And I think that that's something I think about, and it's a good question for the Alliance. And we might be able to find it if you look at the National Domestic Worker Alliance in Aaliyah. And I know that, I think the Rockefeller, I know that it had some funding, and this is an innovation that allows, and that's the kind of thing that would be great to get out on media. We have people at the university who have come up to us and said, gee, I have a cleaning lady, right? Like, as if this was, and I don't know what to do, right? Like, how do I do this and do it the right way? Because we like the work you're doing, Center for Women Work, or the National New Labor Domestic Workers Alliance. How am I not part of the problem here? And so I think that, as they're, these are things that some communities would really be receptive to and want to contribute. So it's important. So we can, I'm going to look that up later today.
Can I just say that what you just said is actually one of the important interventions that was made, is shifting from the future of work to the future of workers, and thinking about the ways that technology actually can be used for the purposes of improving the conditions of workers' lives versus creating restrictions and making it more difficult, or decreasing the work that people have. And so I think that actually really speaks to that piece around the future of work and work.
Yeah. Thank you. And monitoring, right? That's another way the future of work is, monitoring things. Another question that I think we still have time for is this is an interesting question. How can we promote the benefits of self-care within the community of care workers that are focused on caring for others? So that's a great question. I know that Miriam or Sheri, did you want to respond? I have a response, but
yeah, I think it's important that we work with a lot of our women to deal with issues of stress. We have a number of programs here that we put together to make sure that they have that little time in their life to disconnect. I think it's critical for them and their families that our women can do that. The hospital opened a fitness center, and we push for the fitness center to be something that people could afford. And that we were providing programming within that fitness center that was free of charge, regardless if you were a member or not. And we made sure that programming was at night, on the weekend. We are doing Reiki and yoga and many forms of self-care that, women talk to us about, that they wanted it to do, that they never had the opportunity to do, or it wasn't offered in the language that they could understand. And we had to get people that could do it in other languages. And those are very successful. And we run a lot of those, but also doing things in the community. Like we are sponsoring something called Ciclovia, where people can get to know their residents, walk on the streets, get to know the kids in your neighborhood, talk to other people, exercise in your community in safe spaces. We just opened a new soccer field in the community, and places for the community to come out and feel safe at, and do things outside of their homes. I think is going to be critical for many of organizations like ours to engage in that kind of work with the community.
Yeah. Well, I really appreciate all of you being part of this panel, and hope I did an okay job as a moderator. You each have so much to say, so much experience, and I am hopeful that we will have that all of this anguish and loss and reveals of the last year will lead to a more caring economy, and probably a lot more organizing will need to come along with that. But I really appreciate the conversation. I think that we're almost at time. And again, thank the IWL for creating the time and space to focus on care work this year.